An annual global event, Bone and Joint National Awareness Week, is held October 12th through 20th, with activities focused on disorders including arthritis, back pain, osteoporosis, and trauma. The week's events are designed to raise awareness of prevention, disease management, and treatments. There are 5 featured days during the National Awareness Week. October 12th is World Arthritis Day. October 16th is World Spine Day. October 17th is World Trauma Day. October 19th is World Pediatric Bone and Joint Day. And October 20th is World Osteoporosis Day. A report titled "The Burden of Major Musculoskeletal Conditions" states that bone and joint conditions are the most common cause of severe long-term pain and physical disability worldwide, affecting hundreds of millions of people. Dr. Jon Radnothy, part of the Florida Hospital Waterman Joint Replacement Center team, explains the problem of deteriorating joints and the impact that it has on both your physical and mental well-being.
There's nothing worse than not being able to be active. When it gets to the point where somebody cannot go down to the end of their driveway to pick up the mail, or they even can't get from their bedroom to the kitchen, let alone go out and exercise, go to the movie, take that trip, when it gets to that point that their activities has been so much decreased, their lifestyle has been altered so much, they really need to consider having some kind of joint replacement to get that fixed. The problem is, the more arthritis you get, the more pain you can get, pain or instability. And I might add that some patients, even though they have bad arthritis in a joint, they may not be hurting that much. They're born with a high pain threshold, but they have a knee that's unstable. So then the concern becomes, okay, are they going to be walking down the sidewalk, the knee gives way, and they fall and break their hip? So the 2 things that you get concerned about is pain and instability. But having said that, if their lifestyle is being altered to that degree, what typically happens is they become less and less active. As they become less and less active, of course, they're sitting and riding instead of walking, standing. The rest of their body gets in worse shape, not just the rest of the joints and their musculoskeletal system, but their cardiovascular system, everything starts to get worse. As they get more and more out of shape, they're doing less and less still, so it becomes a catch-22. And then, of course, the emotional part comes in. They start getting down in the dumps, they start getting bummed out, they start getting depressed, their spouse starts getting depressed, because the spouse is going to do things and they're sitting here and they can't do things, so it just becomes a very bad downward spiral, physically and emotionally.
For more information on the treatments available at Florida Hospital Waterman's Joint Replacement Center, follow the Joint Health Awareness story icon at yourhometownhealth.com.